Welcome to the Studio Chat podcast. My name is Barbara Thompson. Each week, I'll be bringing you a self-care expert or a message to help you to discover how to live your best life and understand your mind-body connection. Thanks for spending some time with me today. Now, let the Studio Chat begin. I really enjoyed my chat with Eleni today. It was really nice to meet her and have a chat all about this beautiful craft of being a chiropractor and what she does and how she helps people really obtain optimal health in their life and their health and well-being. I learned a lot, and before I spoke with her today, I wrote down a couple of questions because what I wanted to get out of this podcast and what I would love for you to get out of this podcast is to have an overall understanding of what is a chiropractor? What do they actually do? And if you have seen a chiropractor before, I still wanted to really bring this to the forefront of self-care as something to add to your self-care toolkit as a choice for you for your health and well-being. But I also wanted to bring this podcast to someone that has never been to a chiropractor before, and you may have a few questions and want to know more about it. So I tried to factor all of that in there. Okay, let's dive in to episode 35, talking with Dr. Eleni Mahanidis all about chiropractic care. Today on my podcast, I have Dr. Eleni Mahanidis joining me. It's so lovely to have you here today. Thank you.
Thank you. Hi, nice to be here.
And the sun's out. It's such a beautiful day. And I'm really excited to talk to you about this, about what you do. And I've been following you for a while on Instagram, and I just love everything about you and your business and how you help people at your practice. So I'd love for you to share with my listeners a bit about you and what got you into this work of being a chiropractor.
Thank you. Thank you. So grateful to be here talking to you today. So for those that don't know myself and my family, I am a second generation chiropractor. So we were actually brought up with a father who started a practice in 1978. And my brother is also a chiropractor, and, being raised in a chiropractic family, I realized from a very young age how beneficial chiropractic can be, not only for ourselves, but also, in helping others. And I just saw how much chiropractic care can really help, people with their health and well-being. So it really started from a very, very young age.
Wow, I love that. Now, I know there'll be a lot of people listening, and I'm sure my audience is split in two. There's some people that have seen a chiropractor or see one on a regular basis, and I'm sure there's listeners at the moment that kind of know what one is, but don't really know what one is. And I'd love for you to share with us, what is a chiropractor?
Yeah. So basically, chiropractors, we are registered allied health professionals, first and foremost. So a doctor of chiropractic, we work on correcting dysfunctions in the musculoskeletal and nervous system. Chiropractors, can offer also pain relief for many people. And we generally work on restoring and maintaining normal spinal function. And not only that, we encourage patients to make the necessary lifestyle choices in order to achieve this.
Okay, because I think a lot of may think of it as there's words like an adjustment or cracking, or I think people think, maybe when I'm just injured or something hurts, I might go, my neck is a bit tight or my shoulders are a bit tight.
Yeah.
Maybe I might go and see a chiro.
Yeah. Yeah, and it's a good point you make, because many people think they have to be in pain to see a chiropractor or to see another allied health professional, and that's in many cases not the case. The reason for that is what we work on, yes, we help with pain relief in many cases, but there's so much involved in, preventative measures as well, and preventative care to help avoid these things from occurring at a later time.
Yeah, I really like that. And I believe it's So from my point of view and the type of clients I see in my studio, it's all about the holistic care. It's not waiting for something to happen. It's
Yeah.
like, how can you care for your general health and general well-being to give optimal health?
Yeah. And that's when we really, encourage people to look at focusing on the cause of symptoms as opposed to caring specifically for the symptoms. And that's one thing that, people don't realize, that they can benefit so much from chiropractic care, and not realizing that they can feel so much better than what they're already feeling as well. So we often think, oh, but I wasn't in pain, so I didn't need to go. But then when people come in and they get encouraged to come and actually care for themselves, they realize they're actually got so much more optimal health and well-being. They feel so much better. And, I know many people have experienced that and not been able to explain it until they actually come in.
Yeah, I find there's a lot of fear can be a bit of a scary word, but I know that in my circles of friends and family and clients that I speak to, when I talk about chiropractic care, I do sometimes get some people that are like, oh gosh, no, I could never do that.
Mm-hmm.
And then you either get people like me that are like, oh, it is, until you've been and seen an allied health professional and had a treatment plan, it's like, it's amazing. It's the best thing I've probably ever done. But there are those two camps, and that's why I've got you on here today, because I'd love those listeners, especially that are like, oh, no, are sometimes the ones that need it the most, or, and it may help them.
Yeah.
And I would love to just ask you, why should we look at, if anyone's listening to this and they don't really know what a chiropractor does or what it is about and haven't been, why should we look at seeing a chiropractor to our self-care toolkit?
Yeah. So just to touch on your point previously that you made in regards to people having certain apprehensions or, pre-existing ideas of what chiropractors do, many people do think that, it is quite heavy-handed, or they may think that it's just manipulative adjustments. But just to touch on that, what actually people realize when they come in is that chiropractic care is very gentle, very effective. It doesn't only involve manipulative adjustments. So, what people are really relieved to see and experience is that we actually do muscle work, and we do gentle mobilizations and gentle care. So that was just touching on your previous comment, why people, have this misconception about chiropractors, and that's why we're here today discussing how gentle and caring it really is. To answer your question as well regarding why people would come, is that what you?
Yeah, like why should we see a chiropractor? Like, what are the benefits of us? Like, I talk about the self-care, I talk about the toolkit a lot when it comes to self-care, as it's more just what we eat or how we move our body. There's all these different beautiful allied health professionals along the way that our bodies change, our lifestyle changes, certain things happen, and that's when you can tap into a chiropractor. How can a chiropractor help you in your health and well-being?
Yeah, well, look, first and foremost, chiropractic care may help, first and foremost, reduce back pain and discomfort. So, the pain, as we were discussing. But we do see that it may improve nervous system function. Some people experience a decreased amount of stress, or increased energy and well-being. Increased mobility and flexibility within our own body as well. We have had some patients report that there is that overall well-being change. And I think with regards to what you're describing with self-care, that's self-care. That's why people tend to choose to look to allied health such as chiropractic, really working on that self-care and that nurturing not only of our bodies, but also our nervous system. There is a lot more research coming out now to show that. And, if anyone has any questions, I'd be more than happy to, delve further into that.
Yeah. And it's, when we talk about mobility and moving our bodies, I think there's a lot of people out there that use a number or their age as oh, well, I'm 40 now, that's the end of the road. Or, I can't touch my toes, or I can't, something to do with your posture, or, there's certain things that you may have when you're younger, and then people may find that they like mobility. I think there's some people out there that may not even know what mobility is.
Yeah.
Could you just share with some of my audience about what mobility actually means?
Yeah. So mobility is basically the capacity that our body is able to move to a certain point of range of motion, I guess. So when, like you said, people feel like, oh, if they get to a certain point in life, that's it. That's their level of movement that they can do. And, that's the range I can do, and I can't stretch past that point. Now, in order to safely encourage movement, flexibility in our muscles and our joints, chiropractors help to restore that function in our body. So, when you said some people think that's it, that's all I've got. Well, not necessarily, because, chiropractic care is actually for everyone and every age group. And many people don't realize that chiropractors, we can care for people from infants as young as newborns all the way up until the elderly. So there is no endpoint. Obviously, with keeping in mind that every individual is different. So we have to, make a clinical decision based on, what's right for that person in front of us. But we have the ability to modify our care for that person sitting in front of us and for that age group. So it is, gentle and effective.
How beautiful is that? What a wide range of people you're helping.
Yeah.
From newborns. Wow, that's such a beautiful thing. And it's both for guys and girls. It's not like one or the other. I'm just going to ask that question just in case.
Yeah, no, absolutely. Men and women, people, it just definitely is for everyone.
Okay.
Gender, every age.
Yeah. Oh, that's beautiful, because sometimes it's things aren't. So it's nice to know. I know it sounds a simple question, but I guarantee there's probably someone listening to this now going, glad you asked that question.
Yeah, absolutely. Absolutely.
So we mentioned that it is for the wide range of people that it helps. Now, one thing I want to ask you is, I've had it myself, so I'm not going to mention anything at the moment, but what I want to ask you is, does it hurt? Because some adjustments can look a bit full on.
So in most cases, not at all. In fact, most people find having an adjustment very relaxing. So, it in my experience, no. However, you've got to take into account what's actually going on for that person. If they're coming with pain, there is a level of discomfort without even, starting care, and that could be in any sort of therapy. We have to take that into account. But absolutely, are you referring to the adjustment itself that doesn't happen?
Yeah, I think it's more. I'm sure when people think of a chiropractor and them going through what they do with a patient, someone will have a vision of what that looks like, and it just may look a bit awkward, or it may look a bit I think because there is that fear around there that I don't know if I want to see a chiro because it's going to hurt, or it's just something that's a bit out of the unknown for me.
Yeah. And I think that's where communication and with the person in front of you, I always first and foremost have a conversation with the patient in front of me and have a consultation. If there is that apprehension or fear, be it come from a previous experience with, or be it, that they've seen something online or heard something from another person that's created this misconception. So first and foremost, my role as a chiropractor is to make the person feel heard and comfortable, see what they can cope with, and then we can, like I said earlier, it's not only about the adjustment. If there is that fear, there's also that mobilization and massage and muscle work, lifestyle advice as well. But the specific, many people are relieved to realize that the adjustment itself actually does not hurt in many cases. So it's actually really gentle. And like I said, many people have the adjustment and they're like, oh my gosh, loved it.
And I think some people may feel, oh, that feels good already. I know with myself, when I've had treatment, it's like, oh, but I'll just share with you a bit about what happens to me when I go for an adjustment. and I'm sure you may see a lot of people like this, but I get the giggles.
Yeah.
So it's so weird. Like as soon as I get an adjustment, I'm like a little schoolgirl I'm like, oh my God, I'm so sorry. It's not funny. But it must be something within my nervous system or something that when it gets released, like I'm laughing.
Yeah, absolutely. And look, more and more we are, seeing research come out. There is a direct association to the nervous system and the brain as well. So when we look at neurotransmitters, and that's a whole nother conversation for another day. But when we look at, having that serotonin or dopamine release as well, if there, we do often feel that sense of relief, or in your case, laughter.
Laugh, and it's good. Like it feels good. It feels nice.
Absolutely. But like I said, if there is that feeling of unknown when it comes to the adjustment, that comes down to the practitioner at hand, and really explaining to people that there's so much more than just what they feel and think an adjustment is. There's a whole care plan.
Yeah.
So much more. And that's why people often leave our practice feeling so much better,
Yep, and you get a really good night's sleep. Well, you may get a good night's sleep.
Well, did you?
Yeah. The very first time I got it, years and years ago, we're talking about this obviously previously before we recorded it, but my very first time I had an adjustment, I went home and slept straight away. Like it literally had zonked me out, and it was the best sleep ever. It was amazing.
Relaxed. Yeah. And I think just knowing, and I think that's a big part of our skill as chiropractors and therapists, is to really know what the state of the nervous system is, or how that person comes in, whether or not they are overloaded or overwhelmed, or if there's regulation needed in that nervous system, trying to work out what that person needs to go and cope better within the world as well. So you probably obviously needed a really nice
oh yeah, and it was my first one too, so there was a lot of apprehension. But one thing I really want to ask is the noise that you hear.
Mm-hmm. Yeah.
What's going on, and is that okay?
Yeah. So with the noise, you're referring to that popping or clicking or cracking sound that can sometimes occur.
Yeah.
So some adjustments, some people may sometimes feel or hear that noise from the spinal joints. This is simply caused by a gas release from the joint as spinal movement is restored. Okay, so sometimes people won't even hear it. So, no, it's not the bone, but many times what can happen is like a little gas bubble or air pocket can form. Yeah. And then when it's restored, that spinal joint movement is restored, you can hear that sort of noise. So again, in saying that, the first thing I say, we have to modify our care for different age groups as well. So the first thing I often say to parents when they bring their infants or children into the clinic, I'll say, you won't be hearing that noise because we won't be adjusting the joint or the baby in that way. So that's what sometimes people do get a little bit worried about because of the noise. But like I said, we modify cares to suit that age group, to suit that baby or that baby. Mm-hmm. So that's why I think that's why these conversations are so important, because there is that misconception or preconceived idea that it's only that. But
yeah, and I'm glad, thank you for coming on today, because I'm really glad we're having this conversation, because it's such a beautiful thing to really help with people's health in general, not just because when there's something wrong. And I'm really a big believer in caring for yourself for the future, for your future self, and the optimal health that I always mention. But it's I don't want people to miss out on it. Like it will really, from my point of view, what I'm saying is it changed my life, but also you learn. I took some really cool takeaways. Every time, I haven't been for ages and I do need to go, so you need to pull me up for that. But we're not talking about that today. But one thing I love going is I always like extra homework. So I always love seeing my chiro, because he'll give me, all right, Barbs, you need to do these stretches and do this or do this. So I love it, because I love learning about the body, but I love what else can I do at home?
That's right. Yeah.
To help me. And so I love hearing all that kind of stuff as well.
Yeah, no, that's great. And it's and that's one thing that I think it's really important to explain is that, yeah, we do also focus on the home care and what benefits or lifestyle choices you can make to achieve, optimal well-being. And, it's not only just that moment in front with your chiropractor at hand. Like, there's a whole conversation about how we can promote a healthier lifestyle, such as, moving the body, exercising, breathing more, reducing our stress levels, eating well, seeking support from other healthcare practitioners, and that's a big thing that we must also talk about. And I know you connect a lot with people in the community. Co-management of care, that's one thing that I personally think is important too. So if a person in front of you, needs to have co-management of care with other practitioners, that's important also to encourage.
Yeah. And it's something that I'd love everyone listening to this now to check in to see how they're sitting. How is your posture? Everyone's going to be like shoulders back. And it's interesting because, I've had a job where I've sat down a lot, and I've noticed that I've been for care to help with my posture. Yeah. And it makes such a big difference. But what happens is when I'm in the community and I'm looking around at everyone else, it is so interesting.
Yeah.
Looking at until you know what you're looking at, and I'm just making an observation for myself, is it's so much more than just fixing an injury or something. This is really helped me, and it can help people. Like right now, how is your posture? And I'm sure everyone's giggling, going, oh my God, yep, I'll sit up straight, because we don't do it.
Absolutely. And I'm so glad you brought that up, because now more than ever, particularly in the last couple of years, we've seen more and more people working from home in their home offices. And that's been a huge conversation that we need to have with people too. Not only people who are working at the desk, we're also seeing it more and more in, children and teenagers, especially with devices, technology. So, they're the things that we really want to encourage and really, I guess, empower the young generations coming through to know the importance of spinal health, but also postural care, and why it's so important that, we can have a really nice posture, not only for our spine and our muscles, but also, for all the organs that are, the nerves are innervating as well. So even just...
Yeah, sorry, can it help with your mental health as well? Is it all connected?
Well, look, when we delve in deeper into the nervous system, the connections, one big area, without getting too technical with the nervous system, but, we know many people know or may have known about the vagus system, the vagal nerve, for example. And that's a big one that, ties in with, there's a lot of people encouraging people to breathe more or slow down breath, which can help reduce vagal tone, which can actually help too. And we have seen studies that show that can help with stress and anxiety. Now, if we're restoring the way that a person is able to breathe, we've got to look at the way that their rib cage and their posture encourages increased lung expansion and capacity. So if you've got, many times we see with people with stress and anxiety, you'll see that short, shallow breathing from the chest rather than diaphragmatic breathing. So if we can actually help restore the way that the person can sit up straight and physically open up that lung expansion, we'll see an improvement in their vagal tone, which then in turn can encourage a greater sense of calm, restoring, helping with anxiety and stress as well. And, many people don't realize, we know it's important to breathe, but we've also got to help people be able to breathe correctly too. And that's a big part that chiropractic has to play as well. So that that's a whole nother conversation for another day, but hopefully that sort of paints a nice picture.
Yeah. You guys are amazing. I really love what you do. And that's the reason why you are called doctors. So I do want people to know that you are a doctor. So that's very clear. One thing I do want to say too is that conversation that you just beautifully shared with us. So thank you for doing that. Everyone listening right now is sitting up straight and they're really mindful of their breathing. So thank you for sharing that, because not only are you spreading your message about what chiropractic care is,
yeah,
you have just, everyone that's listening to this right now has just sat up straight and it's like, oh yeah, how am I breathing?
Yeah, absolutely. And you know what, many times when I'm having these discussions with my patients in the practice, I'm also like, let's do it together, actually, because I think it's important not only for, us to tell people to do it, but us to do it. So you and I just sat up much nicer and then we took a deep breath. And look, you do feel better. You do. So that's, when we talk about why do we feel better when we leave the chiropractic clinic, it's not only the adjustment, it's all these things that we're talking about connecting with, and that's a big part of the home care too.
Yeah, and it's really nice having someone that you see on a regular basis that really knows what you like and what you don't like. So my chiro, he knows exactly what I like and what I don't like. And that, I think, really, I find that just I really get the most out of it and I really enjoy it.
Yes.
It's enjoyable. So I want people to hear that.
Yes.
It's not scary.
Many people often, it's interesting to actually see an experience when people leave and often say, thank you for actually listening and not, taking that into account, because I'll often say, like you said to me today, this is about you, and we're talking about everything that you're about. I also do the same for my patients. Well, let's tell me how you're feeling today, and then I will basically work with them to make them feel most comfortable, most at ease, and leave feeling heard as well. And I think that's a big part when you say about there's often that fear. Well, we're always going to do everything we can to help that person. So that's a big part of healthcare and well-being as well.
Yeah, yeah. So when we're talking about the benefits of going, is there anything that you can share with me? How often? I know it's really specific to whoever is going into the clinic, but is there anything at all that you can share with anyone listening right now that they may be thinking, is this for me? I know it's for all of us, but I didn't realize that this may help this, or
I'm glad you brought this up, because this is also another thing that people feel sometimes. I've heard people say, I haven't gone to this practitioner, I haven't gone to seek out this care because I don't want to have to go all the time once I start, or I want to do this or I want to do that. Now, it's very individualized. So, how often is a tricky question to answer, only because I can speak from my own personal experience as a practitioner. I always tell my patients I'm very individually based, so patient-centered. So I will work with the patient so that they can, and we can help them feel it better, but also empower them to have to also implement the things at home, so that they're just touching base with me as well, and we're assisting them in, maintaining their own lifestyle choices as well. But there are a number of benefits that we have seen with chiropractic care. The list ranges. So do you have anything specific that you're interested in?
Well, we've spoken about posture. Is there anything when we look at women's health? I mean, let's talk about pregnancy.
Okay. Yeah. Perfect. Because pregnancy is one of the areas I see daily. So with pregnancy, it's definitely a time of rapid physical and emotional change for women. So during this time, it's important that women who are pregnant nurture themselves, not only by remaining active, eating well, resting, and looking after their posture, but pregnancy is important in the sense that, as women are going through these changes in their body, we want to make sure that their pelvis, where the baby is growing and developing, is aligned, and making sure that if there is any what we call pelvic dystocia, positional change in the woman's pelvis, we are helping to reduce any intrauterine constraints of the baby. There's a lot of women, there's a recent research that shows that many women often experience low back pain during pregnancy and labor. So there's one specific study here, and we can list the reference if anyone needs to hear it, that women who received chiropractic care also reported less pain during labor. But it's also important in many ways. The other thing as well, I will add on that while we're talking about pregnancy, because pregnancy, I will note that the adjustments that we do for pregnancy is modified. So although people have that idea of what you were just describing before about the big cracks and whatnot, let's just point out that there's a lot of gentle mobilization, muscle work, ligamentous release, really calming and therapeutic, relaxing care involved. So often pregnant women will come to the clinic, and it's really preparing them for that birth and that beautiful time in the lead up to the actual birth as well. So many pregnant women who come to the clinic just really see it as such an important part of their journey.
So if someone's listening to this and they haven't been to a chiropractor before, and they may be early stages on in their pregnancy, can they come in? And if someone's near the end, can they come in for treatment? Like, is there a cut-off time that it's like exercise? If you haven't exercised before you're pregnant, like it's advised to keep your level of activity the same as pre-pregnancy to keep you going through.
Yeah.
So
really, glad you asked that, because that's often a common question as well. Women aren't sure when they can or can't come. And now the reality is that they can come all the way through. So I say women pre-conception.
Yeah.
When they are actually trying to fall pregnant, so with fertility and whatnot, but preconception right up until the day they have the baby. And
go day.
postpartum, so one of the areas that we also work on is postpartum care as well. So we can see a woman after they've had the baby too. If there has been intervention involved, obviously we keep that in mind and modify our care accordingly. So women are often really thrilled and relieved to know that they can see their chiropractor right through their pregnancy journey.
Oh, that's really nice, especially with and can I just add something in there? Even for a lot of us women or guys are listening to this that have lower back pain, even if you're not pregnant.
Yeah.
Having chiropractic care may help you with your lower back pain, because I know that is a common.
Absolutely, very common. Yes.
Right.
Very common. And what we're looking at there is whether there is any underlying nerve irritation, spinal dysfunction, compression on the discs, muscle spasming. So we do a lot of lower back pain for many people, women and men.
Yeah, that was something. What else in particular interests you in women's health? Is there anything else that you want to discuss? We just discussed pregnancy, obviously regulating the nervous system, posture. Is there anything else that chiropractic care may help?
Yes, with regards to women's health specifically.
Yeah.
Look, women's health is, there's a broad range of facets. I will add that this often, when it comes to women's health, we are often co-managing if there is any other professionals or specialists that women are seeing, such as if there are hormonal imbalances, if they have any sort of pelvic floor trouble as well. I might add that, often I will co-manage with other therapists if need be. When we look at women specifically for women's health, we touched on it earlier in regards to, I know you said a lot of women who suffer, if there are women who have digestive issues, or if they have, any kind of stress response and things like, and men are in the same category as well. We look at helping them from a complete lifestyle and wellbeing level as well. So it really depends on what specific thing that a woman is coming in to see me about.
Okay. No, that it just, the main point of us having a chat today is for really to shine a light on your industry and the beautiful job and how you really care and help people and the reasons why they'd come and see you, and to dispel that myth that people have that resistance because it's fearful, because it's like, it's not my thing. It's not my thing, Barbara. I've had many people go, it's not my thing. I'm like, no, I promise you. And there's many people I know that keep saying to me, they've got this pain or got this pain. I'm like, they've done everything. And I'm like, no, you need it. Just try it just try it once. And then tell me.
And I think it's important to really understand who they are seeing as well. We will keep in mind that, there are different practitioners and different ways in which people care for people in every industries too. So, when you have the friends that have sort of had those comments, it's probably about finding the practitioner that suits them as well. We will have I'll personally modify my care for the person in front of me. If they don't like a specific type of technique, I have a range of different techniques and different approaches that can cater for each and everyone. So it's also about, because people realizing that there's so much more involved, and hopefully we've answered a few people's questions, and I'd be more than happy if anyone wants to reach out and chat or consult.
Because like you said, it is very specialized care. So we all know, we're all like on many of my podcasts, people would have, if they listen to them, they'll hear me say each of us has a fingerprint. And I really like to use that for all of our healthcare needs. Everything, how we eat, how we move our bodies, how we sleep. Just because I need that doesn't necessarily mean someone else needs that. And we've got a fingerprint, which means we're all very different. And how we care and look after ourselves needs to be very different. And the kicker is, our body changes every so many years, every 7 to 10 years, that we have a whole new, like everything really. We're very lucky. Our body's a beautiful thing.
Yeah.
But people hold on to, this works for me and it's worked for me, I'm going to keep going. And then they get into a spiral of, disbelief and they're really disheartened because this used to work for me 10 years ago.
Mm-hmm.
Why is this not working for me anymore? And it's just like maybe their nutritional needs or something. They've eaten something and now it doesn't agree with them, and
yes,
it's not working. And it can be the same with healthcare professionals as, I've never had to do anything because I've always been fine. Or I've done this modality and now it's not working. And that's why this podcast is there for people, especially for women, to be like, to be a safe platform of really expert people that are genuinely here to help people, but to help them with like a person-centered approach. And obviously me coming out the other end being a counsellor, so and that's how we're taught. Obviously it's person-centered approach is who you have sitting in front of you.
That's right.
Help that person at that time with that need.
Correct. Yeah. And that's the thing, we've got to remember that, we're faced at different times in our life, or we're faced with different stressors that are placed in our body. And one thing that people often think that, chiropractic care is only for the physical stresses on our body. So, you've bent over to pick up a pen and you've hurt your back, and then I've got to see a chiropractor. But, when you were talking about changes in our lifestyle, there are other stressors placed on our body. And chemical stresses, emotional, even you mentioned earlier before, and this can, affect our physical body as well. So, it's important to look at the person as a whole. I personally, my approach is holistic care, and I think that's why we have, we're having this conversation today, because it's, something that your listeners really are all about. And we, yourself and I and other people that you've had on here, is about helping people not only in one way, but looking at the approach from a completely holistic way.
Yeah, and also a way of the person or the patient or the client being their own advocate. And that's what I'm really big on too, is educating people. Not that this healthcare modality or whatever is for them. It's like, this is the benefits and this is how it can help you. And educating people to try it, because people just don't know what they don't know.
Yeah, that's exactly right. Absolutely right. And I think it's important for all of us, to recognize and appreciate all of the ways in which each modality helps people as well. So when I was saying earlier in regards to co-management, and we talk specifically about women's health, if there is a pelvic floor issue, for example, I will also encourage the woman in front of me to, let's make sure that you've also seen this specialist, seen this therapist, make sure that everything underlying is working the way it should. And then I'll know that my care will help them better as well. So that's really our role as chiropractors that people don't realize, and other, allied health practitioners, is to make sure that we're doing the best we can to help that person in front of us. And, when we look at healthcare from that perspective, I think, working together to help people, it's the best approach.
Yeah, I think so. And I've got a smile on my face because as you were talking and you mentioned pelvic health and stuff, I think people, I'm going to thank you for my listeners, on behalf of my listeners, because today there are people out there listening that are sitting up straight, breathing right, doing their giggles. So everyone's sitting up straight, breathing, and doing their exercises to make sure that their pelvic health is like tops. So thank you for that. You're very powerful.
I didn't realize I was that.
And so when we're wrapping up, I always ask all of my guests this question, and it's, what's one tip or piece of advice or something that you would like to share with my listeners today?
Yeah. That's a really good. Well, we've touched on so much today, haven't we?
Well, actually, you've got everyone to do their exercises, so I think that's a good that's a good thing.
My biggest advice would be to really believe within yourself and your body's potential as well. So many times people will, like you said earlier in our discussion, this is me and this is how I feel, and I feel like this is the only way it's going to be. But we've got to realize that help is there for people. Your body can feel so much better if we help nurture it. And there are people like myself, like other therapists out there who have the tools and the skills and the expertise to actually help you live a more fulfilling, more optimal and well life. And know that there is help out there, and we can feel better.
I think there's a lot of people out there. I know there's a lot of people out there that don't know what it feels like to feel good.
Yes.
Like they do use a number or genetics, or they use something as a crux that I've always had this, or this is just it, or even just tweaking a few things in their life or their lifestyle and a holistic approach can be mind-blowing. And they're like, and they almost are dumbfounded. Oh my God, I had a good night's sleep, or oh my gosh, my tummy feels better, or my anxiety feels better, or whatever the thing is. People are like, oh, wow, as if, oh my God, I can't believe I feel like this.
Yeah. And look, and one thing I often say to people, if they've had these conversations with friends and they're not sure if chiropractic is for them, I often say to them, you've gotten yourself here and that's the first step. And the rest, you implement one thing per day, and we tell people, I mean, myself included, we do one thing that's good for our bodies in the day. And, these things, whether it be, you drank more water, or you went for that walk in the morning, or you literally just took 5 to 10 minutes to sit, breathe, stretch, have time out, we're implementing that one thing per day. So my advice would be, if people are unsure or not sure whether chiropractic is for them, make the phone call, have a conversation with the practitioner. That's the first step. And then everything else should follow if you're with the right person. And exactly like, with your self-care that you advise people to do, specifically women. I know a lot of your audience are women, and there are men out there as well. It's relevant for everyone. Just, take one step at a time, and, know that people are there to assist you.
Yeah, I love that. Now, if anyone's listening to this and they do live in the Illawarra region, or if they don't, like they want to book an appointment or ask you any questions or contact you, what's the best way of someone reaching out to you?
Yeah, so just to reiterate, my practice is Mahanidis Chiropractic. I'm based specifically in Wollongong. And the best way to reach us, we actually have a group of practices there's also Woonona and Albion Park. The best way to reach is our website. I think you've
I'll put it in the show notes. Yeah.
Definitely contact or feel free to call my practice in Wollongong and reach out with my beautiful team. We'd be more than happy to assist and talk to you as well. If you wanted to speak directly with me, I'd be more than happy to take some time out and answer any questions people have. We do have social media as well, but yeah, feel free to make the call and go from there. Hopefully this is, even if people are listening that are not in the Illawarra, I, encourage people to, see if there is a local chiropractor out there, and, some healthcare practitioners that can really, help you with what we've discussed today.
Yeah, absolutely. Well, I just want to thank you so much for taking the time out of your day to
Thank
come
you for
on
having
my
me.
podcast and answer all my questions about the beautiful care that you give people. We're very lucky to have people like you in the world. So, yeah.
Likewise, I feel the same way about you, and I feel grateful to be here and be able to, I guess, spread the message, and it's nice to actually sit down and talk about these things.
Yeah, it is nice because, when you're on the same page about caring for people and stuff, when you see clients face to face, it's nice to speak to someone that, in a different field. And I'm always learning new things. So it's
Absolutely.
lovely. So I will put all your contact details and everything on the show notes. So when everyone's listening to the podcast, I'll put your Instagram on there and your website as well so people can get hold of you.
Awesome. Thank you so much for having me. Thank you for your time.
Thank you so much for listening. I hope you enjoyed today's episode and it has inspired you on your self-care journey. Please feel free to share this with a friend and subscribe over on Apple Podcast. I really love hearing your feedback, so guys, please feel free to write a review on Apple and let me know which part of this episode resonated with you the most. To fall in love with yourself is the first secret to happiness. To find out a bit more about Self-Care Studio or the Studio Chat podcast, head over to my Instagram page, self_care_studio, or on my website, selfcarebybarbarathomson.com.au. Really look forward to seeing you on the next episode. Look after you, and I'll catch you soon. Bye!